Hi, everybody. I'm Mike Sonick, and this is my partner.
Hi, I'm Ray Ma.
And we've had the great fortune of having Rachel Wall with our practice for the last 2 days. Rachel Wall is from Inspired Hygiene. This is from North Carolina, and she spent 2 days with our entire team here in Fairfield, Connecticut. So, Rachel, it's been a great couple of days with you here.
Thank you.
And I think, Ray, I think we always think that we're on top of our game, right, Perio?
We thought, until we met Rachel.
we thought we were like the cat's meow or whatever it's called. I mean, we thought we were really good, and we're pretty good. But then when Rachel came in here, she started to unearth a few problems that we had in our own practice.
Yeah. So what we learned was there was a lot of opportunity in hygiene to grow the practice and also to get everybody on the same page and really get recommitted to the things that are the founding standards for your practice.
Right.
And we all get busy, life happens, you're trying to coordinate, new team members and you two getting on the same page, that sometimes it gets lost in the shuffle, the things that you may have committed to a long time ago that maybe even some of the newer team members don't know about.
Right, exactly.
So a lot of today was going back to what are our values, what are we committed to, what are our standards of optimal care, and what is already in place really strongly, and what maybe isn't happening as consistently as you would like. And we really worked on those things.
Because, when I was a resident, I got out of my residency program in the heyday of periodontal therapy back in 1983 at Emory University. And at that time, there were no implants, there was no large bone grafting, no connective tissue grafts at that period of time, and everything was just scaling, root planing, osteosurgery, pocket eliminations. And I think a lot of us have gotten away from the basics in periodontics, not only in our periodontal profession, but in general practices as well.
And most of the periodontal, residency these days focusing mostly on implant therapy.
Right.
Not a lot of old traditional periodontal therapy is being taught anymore. So I think this is a great, pick up where we left before.
Right.
And kind of get everyone on the same page instead of just managing the patient.
Do you know much about insurance programs and how much reimbursement they have for periodontics? Because I think it's less than 10% of all claims are for periodontal therapy.
Yeah, I don't know the exact statistic, but I would say that it's fairly low. And what I would say we have seen is that it's getting harder and harder to get reimbursement for traditional periodontal therapy. And so what's happening is that less and less of that is being done.
Right.
So the disease is not being recognized, it's not being diagnosed and treated properly. So we've got to break out of that and really kind of get back to the core of what is it that we're doing. So one of the things we talked about a lot today was the periodontal maintenance and what is appropriate in a periodontal maintenance, and when does it warrant the patient going back into some type of non-surgical or surgical therapy, regenerative therapy, like what is appropriate. And you guys really hammered out what those criteria were today for your practice and got everybody on board ready to move that forward.
I think it's been a good couple of days. What is the percentage of patients with periodontal disease, active periodontal disease in the United States today?
Well, the AAP says if we combine everybody with mild, moderate, and severe, it's 70%. 50 to 70% of patients of Americans have some level of disease.
And we have over 350 million Americans, 330 million Americans. That's a lot of people with periodontal disease.
Yeah.
It's a largely underdiagnosed disease in a lot of practices.
Yes.
And I know there's a lot of talk today about the systemic oral link, and people say it's strong, people say it's not strong, but I don't think there's anything wrong with good oral hygiene to decrease disease and perhaps lower the C-reactive proteins that we have. In our
risk
body.
for all these other medical complications.
Yeah. So I think it's been great.
Awesome.
Ray, you want to add anything?
No, I was very excited to meet Rachel, and I think we got a lot out of it.
Right.
The most important thing, I thought we get all the team members on the same page.
Yeah.
I think that's great improvement on the team communication.
I mean, I don't know why, but sometimes me saying the same thing over and over again to my team doesn't seem to make much of a difference. So you're an expert because you don't live in Connecticut. Right?
Yeah, that's right.
So thank you for coming.
My pleasure. I loved it. I loved being with your team. Thank you so much.
Okay.
Thank you.
Thank you.
Yay! Awesome.